many times should a man over 60 ejaculate each month? 10, 21, once a week? Or is it better to avoid it altogether? The truth is, even though this is one of the most important questions for long-term male health, almost no one dares to ask it out loud, not to their doctor, not to their friends, and not even to themselves. Why? Because the moment we cross a certain age, we're told, quietly, that our desires no longer matter, that what we do down there should be locked away, tucked into a drawer of things we used to enjoy. But science says something different, very different. In fact, according to a groundbreaking Harvard study, older men who ejaculate more frequently had a significantly lower risk of prostate cancer, up to 33% lower. And yet, millions of men are still left guessing in the dark. Am I doing it too much? Is it wrong if I do it alone? Am I putting my health at risk or helping it? And then there's the flip side. Maybe you're not doing it at all, whether due to age, medical conditions, loss of a partner, or simply lack of desire. And you're wondering, could the lack of release actually be harming my body? You're not alone. In fact, I've spoken with hundreds of men over 60 who struggle with the exact same confusion. Men who wake up in the middle of the night wondering why they feel more tired, more inflamed, more uncomfortable down there, without ever connecting the dots. Let's make one thing clear from the beginning. This is not about pleasure. This is about your health and your prostate, your hormone balance, even your sleep and mood. They're all more connected to this topic than most people realize. So if you're feeling uncertain, ashamed, or even silently judged for having these questions, take a deep breath. Because today we're going to talk about ejaculation after 60 in a way no one else is willing to, openly, respectfully, and backed by science. We'll break down the research. We'll explore what's too little, what might be too much, and what's actually just right, based not on outdated taboos, but on how your body works at this stage of life. And no, you don't need to have a partner to benefit from what you'll learn here, because whether you're single, widowed, divorced, happily married, or somewhere in between, this is your body, your health, and your right to understand what's happening inside of it. By the end of this video, you'll have a clear, honest, and science-based understanding of how often you should ejaculate after 60 to support your prostate, your circulation, and your vitality. It may challenge what you've been told. It might even change how you view yourself. But more importantly, it might just give you back a part of your health that you didn't know was still in reach. Let's begin. My name is Dr. Jennifer Berman. I'm a urologist and sexual health specialist with over 25 years of clinical experience working with men over 40, 50, 60, and even into their 80s. Throughout my career, I've seen a silent epidemic. Men quietly suffering from problems they don't feel comfortable talking about. Men skipping essential conversations with their doctors, not out of neglect, but out of fear, shame, or simply not knowing what's normal anymore. And one of the most common topics they hesitate to bring up? Ejaculation. I've had patients whisper it to me after months of silence. Doc, am I doing it too often? Is it still healthy at my age? Could it be making my prostate worse? These are not inappropriate questions. They're not shameful. They're essential to your long-term health. Because you deserve to know the truth. You see, your body doesn't stop needing attention just because the candles on your birthday cake are increasing. In fact, as we age, understanding how our sexual habits impact our internal health becomes more important, not less. And that's why I created this video. In the next few minutes, I'm going to walk you through what science actually says about ejaculation frequency in men over 60. How often is considered healthy and protective for your prostate? What factors can change your personal safe zone, like medications, cardiovascular health, hormone levels, and relationship status, and how to make the best choices for your body even if you don't feel like talking about it with anyone else? There will be no judgment here, Only clarity, science, and support. This isn't about boosting your ego. It's about protecting your prostate. It's about making peace with your body, your needs, and your biology. With compassion, not criticism. So let's move into what the research really shows. Because you deserve to know the truth. So, let's return to the question most men are too embarrassed to ask. How often should a man over 60 actually ejaculate? Is there a magic number? You might have heard of a Harvard study that made headlines years ago. Researchers followed over 31,000 men for nearly 2 decades. And the result that stunned everyone? Men who ejaculated at least 21 times per month had up to a 33% lower risk of developing prostate cancer compared to those who did it just 4 to 7 times. Yes, you heard that right, 21 times a month. But here's the truth most people miss. That number is not a prescription. It's a data point, a trend that showed benefit, not a rule you have to follow. Because how often you should ejaculate depends on more than age. It depends on your current health, your medications, your hormones, your emotional state, and most importantly, how your body feels. Let's break it down. First, your overall health. If you're in good shape, walk daily, eat well, and manage your stress, then frequent ejaculation, even 10 to 20 times per month, is likely safe and even beneficial. It supports healthy circulation. It keeps your prostate from becoming congested. And it may help balance your hormones naturally. But if you're dealing with multiple chronic conditions, maybe heart disease, diabetes, fatigue, or you're recovering from surgery, then your body might need a gentler rhythm, maybe once a week, maybe once every 2 weeks. That's okay. There's no prize for frequency. There's only the goal of supporting your body, not straining it. Second, medications. Many men over 60 are on prescriptions that directly affect sexual function. Blood pressure medications like beta blockers can reduce libido. Antidepressants often delay or even prevent orgasm. And some prostate medications lower testosterone levels or interfere with arousal altogether. If you've noticed your desire declining or your body responding differently, it's not a character flaw. It might be your prescription. That doesn't mean ejaculation is off the table, but it does mean you'll want to work with your doctor or urologist to find the right rhythm for you. And even if ejaculation is rare, remember this: any frequency is better than none. It's not about how often. It's about keeping the system alive and responsive. Third, your hormone environment. As you age, your testosterone levels drop. That's natural. But low testosterone doesn't always mean low desire, and low desire doesn't always mean you shouldn't ejaculate. In fact, occasional release, even monthly, can help support hormonal balance. It reduces inner pressure, it helps you sleep better, and it restores a sense of emotional calm through the release of feel-good chemicals like dopamine and oxytocin. So if you've gone a few months without thinking about sex, but your body starts sending subtle signals, like pelvic heaviness, restlessness, or more vivid dreams. That could be your body asking for release, not ignoring it. Listen gently. Don't judge. Respond with curiosity. Fourth, let's talk about relationship status. This part matters deeply. Many men over 60 feel unsure about touching themselves. Maybe you're single. Maybe you've lost your partner. Maybe you live alone and feel disconnected. And you wonder, is it wrong to do it by myself? Isn't that something I should have grown out of by now? The answer is no. There is no expiration date on sexual health. And solo release, especially in the absence of a partner, is not only acceptable, it's often essential. The Harvard study found the benefit was from ejaculation itself, not the method. Whether with a partner or alone, the act supports your body's internal cleansing system. It flushes out old fluid. It lowers inflammation. And it brings down stress hormones. You don't need a partner to take care of your prostate. You just need privacy and permission. Fifth, how do you feel afterward? This is one of the most important signals. Some men feel energized, lighter, and emotionally clear after ejaculation. Others feel tired, foggy, or emotionally flat. If you consistently feel worse, that's a clue from your nervous system that something is out of sync. It might be stress, it might be nutrient imbalance, or it might just mean you need more time between releases. On the other hand, if you feel better, physically or emotionally, afterward, that's a strong sign your body is still benefiting from the experience. This is where real wisdom lives, not in charts, not in numbers, but in how your body responds. So what is a safe guideline? Here's a general range many health professionals use based on age. In your 50s, 8 to 15 times per month. In your 60s, 6 to 12 times per month. In your 70s and beyond, 4 to 10 times per month. Again, these aren't rules. They're soft benchmarks, meant to give you perspective, not pressure. The real number that matters is this, the one that keeps your body feeling clear, relaxed, and responsive. And if you're not ejaculating at all, don't panic. You haven't failed. There are many reasons men stop. Medications, emotional pain, loss of connection, chronic illness. If it's been months or even years, just know this. You can return. Gently, gradually, without judgment. Even one release per month can be a meaningful step forward, not just for your body, but for your emotional sense of wholeness. The bottom line is simple. You don't need to chase numbers. You don't need to keep up with some ideal. You just need to stay in conversation with your body, because your prostate still matters. Your energy still matters. And yes, your pleasure still matters. In the next part, I'll share the story of one man who thought he was done forever, until he discovered that reconnecting with himself, even once a month, was enough to transform his entire outlook. Stay with me. It's a story I think you'll recognize. Robert was 67 when he first walked into my clinic. He was well-dressed, polite, and spoke with quiet confidence. On the surface, he looked like the kind of man who had it all together. Retired professor, married for 40 years, 2 grown children, no major health issues. But as he sat down, I could tell something deeper was weighing on him. After a few minutes of small talk, he leaned forward and said in a hushed voice, "Dr. Berman, I don't know if this is silly, but I haven't ejaculated in almost 6 months. Not on purpose. It just stopped happening. And now I feel like something's wrong, like something's stuck inside me." That sentence struck me, because I had heard it, almost word for word, from many other men before him. We talked more. Robert explained that over the last year, he had lost most of his sexual desire, not because of any specific medical issue, but from a slow, creeping sense of detachment from his body. His erections were weaker, his sleep more fragmented, and his energy dipped around midday like clockwork. He had assumed, like most men, that this was simply aging. "You're not supposed to want that stuff anymore," he said with a half smile. "But lately, I've been waking up in the middle of the night with this weird pressure in my lower abdomen, like my body's asking for something I'm ignoring." After a full evaluation, we ruled out major concerns. No cancer, no serious prostate enlargement, no infections. But what Robert was experiencing was very real. His seminal fluid hadn't been released in over 6 months, which meant old prostatic secretions, dead cells, and internal pressure had been building up. His body was sending him subtle signals: pelvic heaviness, sleep disruption, mood changes. It wasn't just physical, it was hormonal and emotional. I gently explained that for men his age, ejaculation is a form of natural detoxification, that the prostate produces fluid continuously, and if it's never released, it can lead to low-grade inflammation, discomfort, and even increase long-term risk. We talked about his relationship. His wife was loving, but they had grown apart in terms of physical intimacy. They slept in separate rooms due to her sleep apnea, and neither of them had brought up intimacy in years. I reassured him that intimacy doesn't have to be a performance, that even solo release, once every 10 to 14 days, could provide relief and help him reconnect with his own body. He looked surprised. "You mean I can do that at my age? It's actually good for me?" I nodded. "Not only good, necessary." We worked out a simple plan. He would focus on reconnection with his body, not just mechanical release. He'd start with breathing exercises, warm showers, and gentle self-touch, without any pressure to finish. And if or when ejaculation happened, even once every couple of weeks, he'd simply observe how his body responded. 3 weeks later, Robert returned, a different man. He looked lighter, more upright, and his voice had a relaxed tone I hadn't heard before. "I don't know how to say this," he told me, "but I feel like me again. I slept through the night for the first time in months. That weird pressure is gone, and I didn't even realize how much tension I was holding down there." His case wasn't rare. It was simply unspoken, like thousands of other men who walk around with discomfort they can't name and needs they've been told to ignore. The truth is, Robert didn't need a prescription. He needed permission to understand his body, to respond to its signals, and to let go of the guilt around something that is not only natural, but healing. Next, I'll explain exactly why ejaculation makes such a difference after 60. We'll look at what's happening inside your body on a microscopic level, and how this one small act can impact inflammation, hormone health, and prostate aging. Let's break it down in simple science. Let's take a moment to step inside the body and to understand why ejaculation matters so much after 60, not just emotionally, but biologically. Because what happens when you ejaculate isn't just a release, it's a system reset. Let's start with the prostate. This small walnut-sized gland sits just below your bladder and wraps around the urethra, the same channel your urine and semen pass through. Its job is to produce prostatic fluid, a nutrient-rich liquid that nourishes and protects sperm. But here's the part most men don't realize. Your prostate doesn't stop producing this fluid, even if you stop ejaculating. That means if there's no regular release, that fluid accumulates inside the gland. Over time, those secretions can become thick, stagnant, and inflammatory. Dead cells build up, microparticles settle, and your prostate starts to feel, quite literally, congested. Think of it like a kitchen sink. 2, it supports hormonal balance ejaculation. Whether solo or with a partner, triggers a cascade of hormonal responses that help regulate your mood, sleep, and stress levels. Here's a simplified look at what's released. Dopamine, the reward chemical, supports motivation and mental clarity. Oxytocin, often called the bonding hormone, helps you feel connected and relaxed. Prolactin, promotes sleep and resets libido levels. Testosterone modulation. While ejaculation may cause a brief dip in testosterone immediately after, regular sexual activity has been linked to overall better hormone regulation in the long term. So if you've been feeling moody, irritable, or restless, even without sexual desire, your body might be missing these neurochemical resets. And remember, this is your biology, not your willpower. 3, improved blood flow and circulation, down there. During arousal and ejaculation, blood flow increases dramatically to the pelvic region. That rush of oxygen-rich blood helps nourish the prostate, penis, and surrounding nerves. It's like a mini workout for your vascular system, and for men over 60 who may already struggle with reduced circulation, this gentle increase in blood flow can help. Maintain tissue elasticity, improve oxygen delivery, reduce stiffness and atrophy, stimulate nitric oxide release, the chemical that keeps blood vessels relaxed and open. In other words, use it. Or lose it applies here too. Regular blood movement keeps the pelvic area healthy and responsive. 4, it may lower risk of prostate cancer. Let's revisit that Harvard study. Researchers tracked more than 31,000 men over nearly 2 decades. They found that those who ejaculated 21 times or more per month had a significantly lower risk of developing prostate cancer. Why? The leading theory is that ejaculation clears out potential carcinogens, environmental toxins, hormone byproducts, and inflammatory proteins before they have time to damage cellular DNA inside the prostate. While this doesn't mean ejaculation prevents cancer, it does suggest that regular clearance is protective, much like detoxifying your liver or keeping your colon moving. The prostate is not a passive gland, it's dynamic, and it responds to use. 5. It's about function, not frequency. Let's be clear, you don't need to ejaculate 21 times a month to be healthy, but what matters is that your system remains functional, that your nerves still fire, that your blood still flows, that your prostate still clears. Even once every 10 to 14 days can be enough to reduce internal congestion, reset your hormones, sleep better, feel more connected to yourself, and maintain a prostate that stays healthy and pain-free as you age. Think of it as regular maintenance, not performance. Just like you wouldn't let your car sit unused for years, your prostate, too, needs movement to stay in good working order. Next, I want to shift the tone, because I know some of you might still feel unsure. Maybe you've ignored this part of your health for years. Maybe you've felt embarrassed, isolated, or ashamed. That's why in the next section, I'll speak to you from a different place, not just as a doctor, but as a fellow human, to show you that it's never too late to start small, heal slowly, and reconnect with the body you still live in. Let's talk about how to begin. If you rinse it out every day, it stays clear, clean, and odor-free. But if you don't run the water for weeks or months, things settle at the bottom. Sludge builds up, odors appear, the drain clogs. Your prostate works the same way. Now, here's where science gets even more interesting. 1. Ejaculation reduces inflammatory pressure. Inside the prostate are tiny tubes and ducts, all lined with epithelial cells. These cells are constantly regenerating and flushing waste products into the prostatic fluid. When you ejaculate, you're clearing out those ducts, removing cellular debris, excess hormones, and irritants that would otherwise sit there and create low-grade inflammation. Without this regular flushing, pressure increases, especially around the urethra, which can make you feel sluggish urination, incomplete emptying, more nighttime trips to the bathroom, a dull ache in the lower pelvis. This isn't always a disease, it's often congestion, and release brings relief. 2. It supports hormonal balance ejaculation, whether solo or with a partner, triggers a cascade of hormonal responses that help regulate your mood, sleep, and stress levels. Here's a simplified look at what's released. Dopamine, the reward chemical, supports motivation and mental clarity. Oxytocin, often called the bonding hormone, helps you feel connected and relaxed. Prolactin, promotes sleep and resets libido levels. Testosterone modulation. While ejaculation may cause a brief dip in testosterone immediately after, regular sexual activity has been linked to overall better hormone regulation in the long term. So if you've been feeling moody, irritable, or restless, even without sexual desire, your body might be missing these neurochemical resets. And remember, this is your biology, not your willpower. 3. Improved blood flow and circulation. Down there. During arousal and ejaculation, blood flow increases dramatically to the pelvic region. That rush of oxygen-rich blood helps nourish the prostate, penis, and surrounding nerves. It's like a mini workout for your vascular system, and for men over 60 who may already struggle with reduced circulation, this gentle increase in blood flow can help. Maintain tissue elasticity, improve oxygen delivery, reduce stiffness and atrophy, stimulate nitric oxide release, the chemical that keeps blood vessels relaxed and open. In other words, use it. Or lose it applies here too. Regular blood movement keeps the pelvic area healthy and responsive. 4. It may lower risk of prostate cancer. Let's revisit that Harvard study. Researchers tracked more than 31,000 men over nearly 2 decades. They found that those who ejaculated 21 times or more per month had a significantly lower risk of developing prostate cancer. Why? The leading theory is that ejaculation clears out potential carcinogens, environmental toxins, hormone byproducts, and inflammatory proteins before they have time to damage cellular DNA inside the prostate. While this doesn't mean ejaculation prevents cancer, it does suggest that regular clearance is protective, much like detoxifying your liver or keeping your colon moving. The prostate is not a passive gland, it's dynamic, and it responds to use. 5. It's about function, not frequency. Let's be clear, you don't need to ejaculate 21 times a month to be healthy, but what matters is that your system remains functional, that your nerves still fire, that your blood still flows, that your prostate still clears. Even once every 10 to 14 days can be enough to reduce internal congestion, reset your hormones, sleep better, feel more connected to yourself, and maintain a prostate that stays healthy and pain-free as you age. Think of it as regular maintenance, not performance. Just like you wouldn't let your car sit unused for years, your prostate, too, needs movement to stay in good working order. Next, I want to shift the tone, because I know some of you might still feel unsure. Maybe you've ignored this part of your health for years. Maybe you felt embarrassed, isolated, or ashamed. That's why in the next section, I'll speak to you from a different place, not just as a doctor, but as a fellow human, to show you that it's never too late to start small. Heal slowly and reconnect with the body you still live in. Let's talk about how to begin. If you've made it this far in the video, I want you to hear this. Not from a doctor, but from someone who's walked beside hundreds of men who thought they were too late. You're not too late. It doesn't matter if you've gone weeks, months, or even years without thinking about this part of your health. It doesn't matter if you've felt ashamed, disconnected, or like those days are behind you, because healing doesn't begin with a perfect number. It begins with permission. Permission to listen to your body again. Permission to acknowledge that this part of you never stopped existing. It was just waiting for you to come back. I've seen men in their 70s rediscover a sense of aliveness after decades of silence. I've seen widowers rebuild their connection with themselves, gently, slowly, without guilt. I've seen men recovering from surgery or prostate treatment find peace in simply feeling again, and every one of them started with just one small step. Not a routine, not a schedule, not a goal, just awareness. So here's where I want you to start. Tonight, or sometime this week, take 10 minutes for yourself. Not for performance, not for results, just to be present in your own body. That might mean sitting quietly with your hand on your lower abdomen, breathing deeply, taking a warm shower and noticing how your body feels without judgment. Gently touching yourself, not to do anything, but simply to reconnect. Writing down how your body has changed and what it might be asking for, because so many men are stuck in a cycle of silence. They wait for their body to act right, again before they listen to it. But the healing starts the other way around. Your body isn't asking you to be who you were at 30. It's asking you to be curious, now at 60 or 70, about the man you still are. Maybe you start with once a month, maybe once every 2 weeks. There's no prize for numbers, but there is relief in rhythm. A rhythm your prostate, your hormones, and your sense of peace can begin to count on. And if this feels awkward, strange, or even emotional, that's okay. No one taught you how to care for this part of your health after a certain age, but you're learning now. And that makes all the difference. In the final part of this video, I'll leave you with a message from the heart and a gentle invitation to share your journey, not just for yourself, but for the silent thousands who need to hear this conversation too. Let's finish together, softly. Before we part ways today, I want to remind you of something simple but powerful. Your health doesn't stop at your heart, your blood pressure, or your cholesterol. It includes your confidence, your comfort, your connection to yourself, your sexual health, even at 60, 70, or beyond, isn't a leftover piece of your youth. It's a vital part of your well-being, and caring for it isn't selfish. It's responsible. You're not broken. You're not shameful. You're a man living in a body that still speaks to you, even if it whispers instead of shouts. So if this video gave you even a small sense of clarity, if it answered a question you were too afraid to ask out loud, if it reminded you that your needs are still real and still valid, then please, don't keep that to yourself. Leave a comment below. Let me know what part spoke to you most. Or simply type, "still here," so others scrolling through know they're not alone. And if you think someone in your life, a brother, a friend, even your father, might need to hear this too, share it with them. One quiet video can spark a life-changing conversation. We need more of those. And finally, if you'd like to be part of a space where we talk about real health, not hype, not shame, then subscribe to this channel, because I'll be back with more science, more clarity, more honest human answers to the questions no one else wants to touch. You matter. Your body still matters. And the time to take care of it is not in the past. It's right now. Thank you for showing up today. Thank you for listening. And thank you, most of all, for choosing yourself. I'll see you in the next video.